cut that was expected this year has been temporarily lifted through the end of the year, through December. So what that essentially means is that those health systems and providers that were to be impacted by that 2% cut will I don't want to call it a 2% increase, but they won't
delayed cuts for disproportionate share hospitals and systems like that.
Correct. And then those hospitals and systems that are dealing directly with COVID patients, there is a 20% add-on for the services that they are providing. So, that's through the Medicare system, one bucket. Then the second bucket is the CARES Act created a $100 billion fund, which is the Public Health and Social Services Emergency Fund. That will be accessible to providers, systems out there that are dealing with COVID patients. This is for non-reimbursable expenses that these facilities and providers are experiencing. So as I mentioned, it's a $100 billion fund. It was not designed in a way, was not designed akin to the general grant programs that we see through the federal government. It was designed to get money infused into the system as quickly as possible. Applications, and the department is still figuring out the final rules for the program, but the direction that Congress gave HHS was get the money out as soon as possible. So entities will submit applications to the department. Those applications will be considered on a rolling basis. The money can be used for, as I mentioned, non-reimbursable expenses. So for expenses that would not normally be reimbursed in a situation like this, and it can be used for increased staffing. Many facilities have to erect temporary facilities to deal with COVID patients to ensure that they're not being mixed with other patients in their facilities. So it can be used for that. It can be used for PPE and other supplies that are needed for frontline workers. So $100 billion intent to get it out into the system as quickly as possible. And then the third pot that I would highlight is not the traditional healthcare program, but it's a program run through the Small Business Administration that is for small businesses, including small practices and smaller systems that meet the definition of a small business. And in some instances, that is fewer than 500 employees. In other instances, it is revenue-based. It is a paycheck protection program. So it essentially is set up to allow systems to apply for this funding through traditional small business lenders, traditional banks that are enrolled in this, and that are on the radar of the Small Business Administration, to cover up to 250% of monthly expenses for payroll, rent, mortgage, utilities, to help those small businesses withstand the COVID-19. That it is a loan, but that loan is forgivable as long as those entities maintain employees and salaries. If not, if there are employee or salary cuts, the maximum terms of the loan are 10 years and 4%. And so those are the three big buckets that I would throw out there in terms of resources.
I think that you made it very clear with breaking it down into those three buckets, Virgil, and especially the part I want to make explicit for our viewers that when you're talking about small businesses, this is inclusive of small physician practices. This is inclusive of those community clinics that really do see disparately, especially in communities that are medically underserved. These are the people who are not only the backbone of the health of that locale, but economically they are the backbone of that area. So thank you so much for making that plain. Jennifer, I want to keep on the lines of the workforce conversation in terms of how COVID-19 is impacting is impacting physicians and health professionals across the continuum. You know, so you mentioned burnout. You mentioned some other things that are really quite detrimental to the care providers that are trying to care for all of us, right? So I want you to expound on that, and I want to add a layer of that, another layer on top of that. Speak to us explicitly about what's going on in rural areas and how COVID-19 may not necessarily have created the issues of shortage and burnout, because that was with us prior to the pandemic. So walk us through how the pandemic might be exacerbating a lot of these issues that we might be familiar with.
Certainly. Yes, as we know, when you look at rural communities, I live in Atlanta, Georgia, for instance, and we have several of those communities where there are several hospital closures. We are very much understaffed from a healthcare workforce standpoint, and we were prior to the pandemic. And so, you have individuals who have to drive, long ways to just access care, who don't, like you said, who do not have a GP or a family practitioner, to mention maybe means, especially that, not Medicaid. So this is definitely something that's been exacerbated because of the pandemic. Same thing with, when you look at your urban hospitals, you're looking at entities where, just when you look at numbers and socioeconomic conditions associated with many of the urban residents that tend to be patients, many of these hospitals are just under-equipped to deal with this. And again, this has been the case even before this time. So it's just been very much escalated, unfortunately. The CARES Act does seek in some ways to address many of these challenges. I'm happy to, share a slide where I can go through some of these.
Sure, please.
So we mentioned the urban health challenges, and as Virgil mentioned, there's an increase to, I think, Medicare reimbursement rates for hospitalizations by 20%. There's a delay in payroll taxes, as well as reductions. They provided funding for purchase of medical supplies, which are very much in demand during this pandemic. When you look at community health centers, they will be receiving money to bolster efforts to combat this pandemic as well. When you look at your rural as well as frontier hospitals, because frontier hospitals tend to experience similar challenges, these hospitals are provided with facilities, cash flow to help maintain adequate workforce, to help recruit adequate workforce. There's supplemental funding for telehealth technologies, which will be a huge help for those who, again, do not live anywhere near a hospital or healthcare facility.
Yeah.
It reauthorizes HRSA grant programs to strengthen rural community health by focusing on quality improvement, increasing healthcare access, coordination of care, and integration of services. It expands telehealth flexibilities. So whereas traditionally Medicare requires an individual to have had a visit with their physician within the past 3 years before being able to take advantage of telehealth services, that is being relaxed during this time. Medicare will reimburse based on the national average payment rates. It allows for the use of telehealth for hospice care recertification, and it also increases payments for physician work in areas where the labor cost is determined to be lower than the national average. So those are some of the big picture ways that I think the CARES Act is aiming to support both your urban versus rural and frontier providers during this time.
And
Yeah,
Mia,
please, go ahead, Virgil.
Mia, if I can just add one other provision of the CARES Act, and forgive me for not mentioning this before. for certain hospitals and systems, the CARES Act allows accelerated payments and advance payments. So for those systems and those hospitals, and again, there are only certain ones that qualify that are struggling now financially because of the need to cancel elective procedures and other strains on the systems. There was an expansion of both advanced and advanced payments under the Medicare system for those systems.
I appreciate you offering that as well. And let's continue with what you were both laying out. Jennifer, you mentioned, and you could see it in the layout, the telehealth provisions, right? And how that could potentially be an opportunity, especially for small businesses or rural, but even also urban settings, to take advantage of creative ways to still see to the needs of their patients, whether or not they're presenting with COVID-19 symptoms. So can you tell us a bit more about the telehealth implications of CARES, the both of you?
Sure. So the reality is many physicians, many systems, many hospitals are dealing with this now.
Yes.
For COVID, for individuals who believe they have COVID systems now, there is a concern that they bring that to the doctor's office or to the hospital. And then for our elderly citizens, exposing them to the disease by going into the hospital or doctor setting, and other individuals. So there is a major emphasis on telehealth. And actually, the emphasis, it didn't start in the CARES Act. There was a major telehealth expansion in the second bill that Congress passed. However, there were a few tweaks in the CARES Act. One, for the telehealth expansion that occurred in the last bill, there was a requirement that a physician or a provider had to see the individual within the last 3 years in order to provide telehealth services that would be reimbursable. The CARES Act removed that requirement. So a provider is no longer restrained to individuals that they've seen before in the last 3 years. The other big change in the bill is now community health centers, rural health centers are able to provide, as Jennifer mentioned, telehealth services and be reimbursed for those services. As Jennifer just laid out before, in many communities, it is the community health center or the rural health center that is the front line of care for those individuals. So those entities are now able to provide telehealth services. And then another big area where, and again, this is not COVID-19 related, but it is an impact of, it is a result of where we find ourselves now, home dialysis. That is also now, those services are now able to be provided through a telehealth setting as well.
Jennifer, did you have anything to add to that?
I will just, Virgil did an amazing job, I think, of laying that out. I'll just add that for smaller entities, maybe in rural areas who may need help getting up to speed to make their telehealth program successful. I do believe the HRSA, or Health Resources and Services Administration, they do have telehealth resource centers that may be available to support during this time.
And I would just add to that, Jennifer, another agency, federal agency that just took action in the telehealth space was the Federal Communications Commission. They just, the commission has approved a telehealth program. I believe it was $200 million for, it's million or billion, and forgive me, I'll go back and clarify that, but
big number.
Provide telehealth services for providers, and that can actually be used to purchase equipment for those providers that don't currently have the equipment to provide telehealth services.
Yeah. So I want to localize the conversation a bit, and so we know, or at least I'm hoping that the majority of the public knows that New York City is the epicenter of COVID-19 in the US, right? And we will see peaks and valleys as the virus evolves, and as it starts to move across the country and across the world in different ways. But there are some serious, in addition to the medical challenges, there's some social habits that we've all had to collectively come to terms with. So at least in New York, where the moniker is, the city that never sleeps, there's now closing of supermarkets and post offices and banks at earlier times. Appointments are being moved to drive-through only hours, for instance, at different pharmacies. This might be an awkward time for a lot of people. For an introvert like myself, I'm perfectly okay with some adjustments. But to just ratchet it up to beyond the individual level, there are challenges for people who, because of these closures, might have to travel, vast distances to find a supermarket that will accommodate the hours that they're able to go and shop, to find a post office that might be able to really ensure that they're able to do what they need to do. So if you can talk to us about just generally, and this could be anecdotal, but it could also be grounded in numbers. In what ways are people and potential patients impacted by the CARES Act? We talked about this a bit, but I'd like for you to bring in the social aspect a little bit. And you can speak in terms of what you've been seeing amongst your networks, or hearing on television, reading on the news. And actually, if you can also mention, in addition to that, what are some resources that you've been reviewing, whether it be with respect to COVID-19 in general, what are resources that you've been reading about the CARES Act and how all of this might potentially impact how we move forward socially?
I'll jump in. This, as you mentioned, of course, has just been a huge change for all of us, and especially for those in New York City during this time, in so many ways. One, just anxiety.
For sure.
I know that I'm hearing about several mental health concerns that folks are experiencing during this time. Working with the University System of Georgia for the Board of Regents, I know that there has been an increased concern there because of hospital shortages, especially in rural areas. Many of them are not able to accommodate nursing clinicals, residencies, folks who were enrolled in health professions programs. And many of which were on target to graduate this academic semester. So you're looking at, we already have a shortage, and now, we can't graduate folks to that healthcare workforce. So that's one of the major concerns I know that I've been looking into and trying to kind of research and come up with ways to try to navigate those challenges. And like you said, just your everyday needing to go grocery shopping, needing to grab money from the ATM. There's just so many layers that I think, at least myself, I just never even imagined would be touched with the pandemic. I think that, there are some ways that the CARES Act appears to try to directly, support, particularly, I guess, on an individual level, for those who qualify, there is the stimulus funding. I know that employers that meet requirements will be able to receive help to help pay for sick leave and expanded FMLA. So that would hopefully give some breathing room to those employees to be able to take care of themselves should they become ill.
Yes.
With respect to the mandated access to, medicine, 3 months for those who need to self-isolate. I guess that's another resource that would hopefully, maybe someone doesn't need to go to CVS during that time, but of course there's a gap there because, if you have private health insurance or Medicaid, that unfortunately does not apply to you.
Yeah.
And then of course there are just so many ways that are still left open that, we don't have official support for through this act, but I guess we're doing the best that we can. I'll turn it over to Virgil.
Yeah, like two big areas for me that just trouble me and keep me up is thinking about our frontline health workers, and Jennifer mentioned anxiety. just the mental health of those individuals who are on the front lines. And we have failed them in terms of giving them the resources that they need in order to be successful in their job. So that is top of mind from me constantly through this. In the CARES Act and in the bill before it tries to address that, but we've seen the horrific stories in terms of shortages, in terms of that PPE and other needed supplies. So, so one is the physical supplies that they need, but it's also the mental health support that they need now, throughout this ordeal, and also after. And then the other big area that is a big concern is the virus, the pandemic is causing individuals to put off procedures and screenings that they would normally have. So whether that's cancer screenings or procedures, out of fear, they're putting those things off. And I'm just fearful for the long-term impact it will have on the health and well-being of folks throughout the country, and just to be as frank and candid, especially when it comes to minority populations.
Sure thing.
It's no secret that we are susceptible and to many diseases on a heightened level, and so I am very, very fearful of the impact that the virus will have on routine screenings, routine procedures for individuals, and hopefully we can get through that.
And your concerns aren't unfounded. I mean, we've seen in previous and even more recent pandemics the impact that pandemics have had specifically on communities of color, on low-income communities, on limited English-speaking communities, right? And disparately, we see that it's a very unique and detrimental impact that the virus will have. Now we're starting to see, so one of the things that unfortunately we don't have collectively are the data that speak directly to what you're talking about, the race and ethnicity data, the language, the preferred language, spoken and written language of patients. And so without those data, we're not able to really delineate resources in a way that would be helpful for providers themselves, so that they don't run out, and that they're also able to add to an equitable distribution of care for their optimal, level of health for all of their patients. And so I use that preference to now ask you, between the both of you, does the CARES Act go far enough, or does its preceding bills, and then collectively, is the impact going to be all that we need? Jennifer, you were talking about FMLA. You were talking about mental health provisions. You and Virgil, you're now just talking about the disparate impact on certain communities and your concerns about the future of our healthcare system. Do these bills do what we need for them to do? And when I say we, I mean collectively as a nation, but we also recognizing that there are factions of our community that we need to be especially careful in terms of considering unique needs, And then also, if it doesn't do enough, what would you want to see in another bill?
Sure. I agree. I think that there's lots of opportunities for growth with respect to this bill. And listening to Virgil, I wanted to add to one of my concerns is, we're in a maternal mortality crisis, and especially with respect to our community, and hearing a lot of what's been proposed for women going into delivery. I have several friends right now who are approaching delivery phase, and it's a scary time because you don't want to think it, but what happens, right?
That's right.
And I think that there is an opportunity for, I know we talked a lot about Medicare, but there's an opportunity for Medicaid expansion to meet more of the need in many areas. I think that there is additional opportunity for home-based services, especially for our aging population. And I think that there is a lack of language that directly supports PPE for direct service professionals who work in these home health settings. We need to, I think, protect that workforce as well. And, and going back to the medications aspect, I think that, there's a baseline provided with respect to those on Medicare, but again, it would not apply to someone like me on private health insurance or someone with Medicaid. So I think that that's just a few of many ways that the bill could grow. Virgil.
Yeah, I would agree with that 100%. And I would say that our members of Congress know and expect that there will have to be one or two additional bills that deal with this pandemic. I think initially the motivating factor was directly addressing the crisis that was before us. And it was stemming the tide for the influx of the patients that we would see, supporting the front line, making changes to programs to ensure that we could deal with the matter at hand that was directly before us. I don't think the Congress has gotten to the point where, which is the next phase of the conversation, which is recovery. And that is a long-term recovery. There will be lasting impacts from this pandemic. And based on the comments thus far from congressional leadership, there is a real awareness that there will have to be a package 4, package 5, maybe even package 6 to deal with the long-term impacts of this pandemic, to deal with a long-term recovery. So we do anticipate that. Some of the more immediate topics that have been thrown out are both the president and members of Congress have discussed hazard pay for our frontline workers. That's an idea, a concept that is kind of caught on. Another area that a focus has been Osha, Occupational Safety and Hazard Administration, and the requirements there, making changes to those requirements for our frontline health workers and professionals. And then there will be other long-term things that we must do to ensure that we recover properly, but also learn the lessons that should be learned from our response to this pandemic, to ensure that if COVID-19 flares up again in the fall or next year, that we're prepared for it and also prepare for any eventual pandemic that may come our way.
Yeah, I appreciate you both offering these insights. The last thing that you especially mentioned about hazard pay and about OSHA reforms, and one thing we didn't so much talk about, but a lot of people, at least here in the audience, and certainly physicians that are part of the American Medical Association, especially our resident doctors, our medical students, all are raising questions about the future of loan repayment and whether or not there's, for medical professionals, and whether or not there's any room in forthcoming bills to really recognize the burden that our providers are taking on every day. And they're taking it on because it's their oath and it's their job, but they're also people. And one of you mentioned that. Jennifer, I think you mentioned that as well. There are people with families who go home, and a lot of them, when they go home, no one can care for them because they've been exposed. I've heard, and this is an aside, and then I'm going to get to audience questions. I've heard from physicians who, when they go home, they stay in tents in their backyard because they don't want to expose themselves. They've been servicing on the front lines all day. They don't want to expose their families. And these are heartbreaking stories, but they're also real. And we all have to certainly recognize the impact that all of this has on those who care for us the most. We have to do a lot to make certain that we're caring for them. So I'm going to go ahead and pivot into some audience questions, and feel free all to keep sending your questions now, and we will be sure to, we'll hopefully be able to get to most, if not all. And if you do have questions that aren't answered, please follow up with Brandon Garrett from NMQF, who can help to put your questions into the right hands and get you some insight. So one of the audience members is asking to, talk about some myths that you might be hearing, social myths, medical myths with respect to COVID-19, and what might be the impact on social attitudes with all of that, and whether or not there are trustworthy institutions that are helping to dispel any of those myths.
I've heard myths surrounding certain medications that can be used to deter infection. I've heard myths about, I'm sure we've all about the hair dryers being used. I do wish that maybe we would get an official stance that would kind of dispel these myths, because I would not want to see any more people get hurt from taking on some of these measures that may actually prove to be more harmful than good.
I mean, I think the other myth that we've all heard is that minorities or African Americans are not susceptible to the virus. It couldn't be further from the truth. We've seen stories of a number of, so I would say minorities, but also young people. We've seen countless stories of young African Americans getting sick of the virus, and the other reality is also dying from the virus. So that's probably the biggest one that I know a lot has gone into dispelling that myth, and I think that it's finally catching on, but that was the biggest one that caused a great concern.
Yeah, I agree with all of that. The hair dryers, that was a fairly new one for me. I just recently heard about the whole hair dryer situation.
What is that?
Jennifer, you wanna expound on that?
I've heard that if you take the hair dryer and place it in your nostril, that it'll keep you from contracting the virus.
Oh wow.
Yeah, let's go ahead and just throw all of that back, because that's not science, right? That's not science at all. To your point about people thinking that if you're a person of color or have some sort of melanin whatsoever, that you're protected against the virus, we really have to be careful about, especially about that one, because what we are seeing are and on top of and layering that with age and particularly with young age, we're still seeing a lot of younger people having parties in spite of the virus. We still see, and this might be touchy for a lot of people, we see a lot of congregations and worship centers of worship still gathering in the way that they would traditionally gather, and not really adhering by if there are state ordinances that say shut down, there's not to be any gathering of 50 or 10 or 5 more than 5 people. We still see all of that, right? And that's disconcerting. There is a question in the audience about race and ethnicity data, and I want to just address this very clearly. Because overall, HHS is not collecting data. Well, I don't want to say that they're not collecting data on race and ethnicity. They're not making public. They're not coordinating just yet with public health institutions to ratchet that data up to a national level and making it available to the public. Although there are efforts in place to make sure that happens. But I do want to shout out the state of Michigan, because Michigan has released their data with respect to cases of COVID-19 and mortalities with respect to COVID-19, and the data are speaking loud and clearly. And essentially it's saying that of those who are dying, most of them are people of color, and more specifically, they are Black and Hispanic, especially Black and Hispanic men. So I do encourage you, in terms of you all who are looking for resources, go to Michigan's State Health Department and take a look at their data and such like that. There's a question from the audience about documents and web pages that summarize the CARES Act, and if you all can just mention any of those, and especially if they speak directly to the health disparity, health inequities. And I do just want to briefly plug that a document that might be helpful to whoever's asked that question is the NAACP. They have a document called the 10 equity considerations of COVID-19, and also to be on the lookout for what the AMA Center for Health Equity will eventually be putting out. And if there are things that you want us to be aware of, then let us know. But I'll turn it over to Virgil and Jennifer if there are places where you've been looking.
If I can, the previous point on data, can you hear me?
Much better.
Sorry about that. To your previous point on data, there is a national concern as it relates to the issue that you just pointed out in terms of race and ethnicity data. Congresswoman Ayanna Pressley out of Michigan, along with. Can you hear me now?
Much better, yes.
Sorry about that. I tried to switch the headphones. Congresswoman Ayanna Pressley out of Massachusetts has led a charge along with other members of the Congressional Black Caucus to require that data be collected and also publicly disclosed. So be on the lookout for that on the data front. And then your question was about, sorry about that.
Yeah, where do you go? Where can people go for a breakdown of the CARES Act?
Yeah, I would direct folks to the official summaries and from the congressional leadership. So Senator Chuck Schumer on his website, he has a very comprehensive summary. As we know, the CARES Act did originate in the Senate, and so the Senate does have some really good resources there, but also the departments and agencies, the federal departments and agencies that are now tasked with putting out the implementing rules and regulations has a number of summaries and directives. So that would be the Department of Health and Human Services and the many agencies within that department that are tasked with the provisions of the implementation of the provisions of the CARES Act. And then also the Small Business Administration, which is responsible for implementing the Paycheck Protection Program. So those are the two big departments and agencies that will have a good wealth of resources for individuals.
I agree, and I'll just add that for nonprofits, I'm interested in kind of looking at summaries specific to them. I know that I found some interesting information with Nonprofit Quarterly, so that may just be one more to add.
And also a shameless plug for my job, Akin Gump, which is, as Mia mentioned, is a global law firm. We have a number of healthcare lawyers, regulatory attorneys, lobbyists who we've all pitched in to release a number of summaries and helpful resources. And they can all be found on our firm's website, akingump.com. It summarizes the legislation, but also has a number of helpful fact sheets for different industries and stakeholders. So we have a number of resources for healthcare stakeholders that will be helpful to individuals.
So there, I think what would be helpful is audience, we will request that NMQF share these mentioned resources in a link on their homepage and any others that that the audience might suggest, and just so that they can live in a place where you all are used to going. Okay, and so I want to go back a little bit to talk about non-traditional settings of care and whether or not the CARES Act is helpful in helping them to facilitate a ratcheted up level of care. So what about mobile clinics? And if either of you are able to speak to how they may be typically funded and whether or not the CARES Act bears on the way that they're able to care for people, and especially mobile clinics that are servicing migrant farm workers or those who just don't necessarily have a regular home of care. Can you speak to that? Or you can, or even if it's not mobile clinics in particular, because to my knowledge, the CARES Act doesn't explicitly name mobile clinics as a supported entity. Although again, we've also identified that the CARES Act may not necessarily go far enough in service in that way, right?
Yeah. Yeah, it's not from what I've seen, it's not explicit in the CARES Act, but I know that a number of mobile clinics are funded through local and state governments, The CARES Act does provide resources for both localities and state entities. There is a substantial investment in HRSA, a number of other health program, traditional health programs for workforce. So in addition to the other buckets of funding that we mentioned previously, the other traditional programs did receive substantial appropriations or budget increases. So while mobile clinics are not explicitly mentioned in the Act, there are certainly a number of pots of funding there that I think in states could tap into.
Yeah.
Okay, and I think that adds, going back to the conversation around opportunities to address gaps and the CARES Act, I think that perhaps that's also an area for growth to make sure that those with private insurance or Medicaid specifically will be able to access care in those mobile clinics as well and have it covered, especially as it relates to COVID-19.
Yeah, for sure. For sure. So we're going to probably receive maybe one more question from the audience, but in the meantime, Jennifer and Virgil, if there's anything that you would want to add that you either want to expound on or that we haven't addressed, we can do that. And then I want to go to one more question from the audience, and then we'll close the conversation.
I would just add, I mean, this is not related to the bill itself, but just take care of yourself.
Yes.
We are all experiencing a new normal that requires some level of adjustment for ourselves. But in the course of it, as Jennifer alluded to the anxiety before, there is a certain level of anxiety that comes with anything that's new. And then we multiply that with the anxieties of the virus. Now is no better time to take care of yourself. And what does that look like? Like for me, my fiance and I, we take time every day to go out for a walk in our neighborhood. Of course, we abide by the social distancing guidelines. So we make sure that we don't cross paths with other individuals, and we're in Los Angeles, so there's a directive now to wear masks when you go out. So we abide by that as well. But we just take time every day to make sure that we go out for a long walk, to get out, get away from the news, the anxiety that comes with the news, the anxiety that comes with working in what for many is a comfort setting. So for many folks, you don't equate work with your home. Home is a place to get away from work, a place to relax. Yes. And now we find ourselves working all day in our home. So that's the thing that I would just throw out there for folks. Just find time to take care of you.
I agree. I think that's an excellent point, Virgil. I think that many of us are, we're kind of foreign to engage in self-care. We're very busy, and it shows in chronic disease numbers. And so I think that now is a time to, if you don't know what that looks like, to do some soul searching and find it. One of the things that I've enjoyed, I've seen several links to virtual tours of some of your very famous museums. And for me, that's been really interesting because, I was able to see a museum in Paris from my couch in Atlanta, Georgia, So that's something that I don't know that I would have found, but not for this time. So I think seeking out just new ways to engage in self-care and just kind of take care of your mental health during this time is essential, and to check on folks who you think may be strong or who has it all together, because I think during this time especially we really need to make sure that everyone is on par when we're talking about mental health.
I hear that for sure, and not to speak anything terrible into existence, but just realistically speaking, we might, in addition to seeing a resurge of COVID-19 in the fall in an evolved fashion, or seasonally, I think we will also need to anticipate an upsurge in mental health disease moving forward, right? That will So I appreciate you both offering that. I'm pretty certain, and I'm hopeful that everyone in the audience has a really strong and really just uncompromising self-care regime. And if not, then that you're establishing one now, and hopefully not necessarily feeling that pressure to consistently be hustling. And these are things that we have to unlearn for ourselves, because to your point, chronic disease is inevitable for those who are consistently under the gun, who are overall stressed. And when we're talking about vulnerabilities to pandemics and public health crises like COVID-19, those are the conditions that make us a lot more susceptible and vulnerable to contracting a condition that we will have trouble, our bodies will have trouble fighting. So thank you both for sharing that. That was quite transparent of you. And I won't leave you hanging. I can just briefly mention some things that I do. I'm not that that question came up, but I'm gonna just tell you anyway. But in terms of my own self-care, I'm really quite big on yoga. Before my studio shut down, it was hot yoga almost exclusively. But just breathing deep, and also because I, like many of you, spend a lot of time in here, I try to make sure that I spend a lot of time in my body and just stretching my arms, taking in the sights of outside, as Virgil mentioned, just from a safe social distance, making sure that you're reaching out to others whom you love, and you've mentioned that, Jennifer, being of service where you can. If you know that there's an elder on your block, maybe they need help with, just if you can just drop a plate off to them, or just give them a nice wave from a safe distance, or give them a call. Many of them have landlines still. Or just overall ground yourself in service and kindness, and not in any sort of cliche way, but I'll leave you with this mantra that I try to take for myself, which is grace, space, and gratitude, right? So consistently giving myself grace that this is a hard time. A lot of us aren't used to this. And to your point, Virgil, it's a new normal. So in what ways am I being okay with either small adjustments that also come with mistakes, right? And being okay with that, or so that's the grace part. The space part is giving myself space to think things through. We have to be really very forward thinking with what has to come next for really battling COVID-19 on a medical front, but then also from a public health and social standpoint, from a policy front. And in order to be thoughtful, you have to be still. You have to give yourself space to really think through and be useful to yourself and to others in that way. And then finally, gratitude, just being grateful and grounding yourself in the small things. I'm grateful for my soft blankets when I'm feeling anxious. I'm grateful for ratchet music when I need to, turn it up a bit. And I just, so all of that, in addition to everything that we bring in our professional lives, just being really grateful for what we can also bring. Because like you said, this time next year, this time 5 years from now, this time 10 years from now, it will have completely changed our world, and we need to be thoughtful about how we can show up now in a gracious, spacious way that's grounded in gratitude. So we are at the 1 minute mark. I just want to foremost say thank you to NMQF for having us on and for helping us to have this platform, and hopefully it's been helpful to everyone who's online. Tell your friends, whatever else you want NMQF to hold, just let them know. Thank you to Dr. Jennifer Ruthledge, and thank you to Mr. Virgil Miller. We appreciate you and your time, and I'm now going to turn it over to Brandon Garrett to formally close us out.
All right. Well, thanks so much, guys. I really do appreciate it. What I've been doing on the side is just sort of taking the Q&A that you sent, or the questions that you put in the chat, and copied them, and going to try to go out and answer them all for everyone, and maybe put a document on our website, and we'll make that available for you all. So just want to again say thank you. Have a good day. Be safe out there. I'm thankful that I finally decided to start wearing my glasses. I can see much better now. But you all have a good day, and have a good weekend. Thanks.
You too. Thank you.